Wonderful. All right. Again, welcome for those of you who are just joining. Tonight, we are going to be sharing about the Dartmouth-Hitchcock Medical Center Advanced Practice Provider Postgraduate Programs. Again, my name is Jessica O'Connor, and I'm a consultant on the workforce development team that helps support the marketing and recruitment of our postgraduate fellowship and residency programs for nurse practitioners and physician assistants. Next slide, Bailey. So today we are hoping to give you a high-level overview of a lot of different pieces. We have 5 accredited postgraduate programs, and we also are going to have each has a representation to speak about the programs, what it entails, what the application looks like. We'll also have representation from the Office of Advanced Practice Providers to welcome you to talk to you a little bit about why you might be considering a postgraduate fellowship or residency program. And then we'll go over high level each one of our 5 programs and then wrap up with hopefully getting you excited and ready for the application process, what you'll need to do for next steps, what the timelines are for each of our programs, and then an opportunity to answer questions. So you are welcome to utilize the chat function for questions, or at the point in the presentation, you can come off mute and or raise your hand and ask any questions that way as well. Please feel free to keep your cameras off if you feel most comfortable with that. That is totally fine. And you also may ask questions in the chat as we go. All right. Thank you so much again for being here. I'd like to share with you, this is a slide that has the beautiful pictures of our postgraduate residency and fellowship program directors. You'll see here Lisa Stevens, who's here with us this evening, and she is the program director of the Hospice and Palliative Medicine Fellowship, Interprofessional Fellowship Program. Jason Johns and Lindsay Schammer are not here with us this evening. They are the co-program directors for the neurology program, but we do have our current fellow, Carrie, who's going to be talking to us about her experience. We have Amelia Kerner, who is the program director, senior program director of the Critical Care Fellowship Program. Chelsea Stoutenberg and Lisa Kotnar are the co-directors of the Cardiothoracic Surgical Residency Program. Lisa is here this evening and we'll talk to you about that program. And then we also have Alex Higgins, who is here to talk about the Otolaryngology Surgical Program as well. So we have a lot of information for you and looking forward to sharing the great programs and opportunities that are available within Dartmouth-Hitchcock Medical Center. So next, I would like to introduce our Office of Advanced Practice Providing team. So Deb Fournier is here, and she is our Chief Advanced Practice Provider Officer. So I'm very excited to welcome both Deb and then Cheryl Alinsky, who is the Director of Professional Development and Education for APPs.
I will actually take it from here, Jess, and then I'll turn it back over to Deb. Welcome, everyone. My name is Cheryl Alinsky. I'm delighted that you all are here. I am the Director of Professional Development and Education for APPs in the Dartmouth Health System. I have a small clinical space in internal medicine, and I have a small teaching position at our Geisel School of Medicine, which is located 3 miles from the medical center, and that is at Dartmouth College. So the Office of APP, as Jess just mentioned, we have a Chief APP Officer, myself. We have a Senior Program Director, Amelia Kerner, who is the Program Director for Critical Care. She's also the lead for Critical Care. We have Chris Dyke, who is and has been for the past almost 3 years, our Education Coordinator. Chris has done everything APP education and programs. And now that the office is expanding, she is going to stay in the education space. And we have just now hired a program coordinator, and that is Ann Hill. So we are delighted that the office is expanding. And we also very much benefit from the relationship that we have with Workforce Development, who is hosting this webinar tonight. And I just want to highlight this to emphasize the broad and deep bench that we have to support these programs. So while we have 5 very active, robust programs that you're going to hear about tonight, we have more in the queue, if you will. More are expressing interest, and we're looking forward to the growth of our programs. I want to emphasize to those of you who are contemplating a postgraduate program right now, whether you are just about to complete your NP or PA program and you're considering a postgraduate program versus entering the workforce directly as a staff APP, this is a big decision that you are holding right now as to whether you want to most likely take a salary cut for a year to dedicate this next year to specialty training. You will see the detail with which these programs tend to offer specialty training. Now, some of you are finished with school, done with school, really have capped your ability to pay out, meaning pay tuition, and are really ready for a full-time staff position, full salary, to start paying back loans, etc. We understand that. So this is a big decision. We acknowledge that. And if there's any help that we can give you tonight, we are happy to do that. At this time, I'd love to turn it over to our Chief APP Officer, Deb Fournier.
Excellent. Thanks, Jessica. Thanks, Cheryl. Great introductions. I'm super excited to be able to pop in on this meeting and introduce myself a little bit and talk about overall the organization's support for these programs. So as you heard, I'm Deb Fournier, just brand new this week in this position as Chief APP Officer, but have been serving as the interim chief for the last year or so. It's really given me an incredible opportunity to learn a lot, not just about the programs, but about our advanced practice providers throughout our health system. So we are a little more than 800 strong across almost a dozen locations, not counting some of our satellites and clinic spaces. So tens of locations where our APPs are practicing in most cases at the top of their scope with support from colleagues as needed and supported again to advance their practice and their professional development and their interests. It's been really incredible to see the influence that these program directors and these programs have on our workforce, the level of commitment, the quality of the education, the engagement is really like something I've never seen before. I've been with this organization about 20 years and I've learned a lot about some of our regional and national partners. And this is really an exceptional group of people. I think that you'll hear about how we have not just had an impact on our own system, but also in the region. You'll hear about how hospice and palliative medicine works with our regional colleagues to have shared interprofessional fellowship sessions. And then you'll also hear about how we've got a national impact where folks are attracted to some of these fellowships from all over the country, and that our faculty and our fellows are presenting and being recognized at a national level, including our programs being acknowledged with distinction with accrediting organizations, excuse me, like APFA. So really excited to have you hear a little bit more about each of these programs, the detail and the depth in which there's academic rigor and support for these fellowships. And again, to emphasize that there's engagement and support at an institutional level, at an organization level throughout our system. We want to continue to have these programs support the overall mission where we are seeking to attract high quality talent, to provide high quality training so that we can provide high quality care, and then to retain high quality staff and have opportunities for ongoing professional development for APPs. So I may not be able to stay on the call too much longer, but I'm really excited to have you hear what's in store the rest of the hour, and happy to take any questions in case I need to jump off, or Jess and Cheryl can, of course, get in touch with me later. I'll turn it back to Jess.
Thank you so much, Deb. It's really wonderful to see all of the opportunities that are arising for APPs, and especially within these fellowship programs. We just recently had one of the professional development sessions with all of the current fellows and residents, and it was such a great experience, not only from a learning perspective, but also an engagement and collaboration and building rapport among the fellows across the different sections. So it is a really unique experience that Dartmouth Hitchcock Medical Center has. And we thank our Office of APPs for all of that guidance. So let's get into the programs. We are going to start off with Lisa Stevens, who will be sharing information about the Hospice and Palliative Medicine Fellowship.
Hi, everyone. I'm so excited to be here tonight to talk to you a little bit about our program. And I know some of you who are on this call are interested in applying or have applied to our program, so we're really excited. Our Hospice and Palliative Medicine Fellowship is an interprofessional fellowship, and the APPs who join our team or our fellowship will be joining 3 other physician fellows. And we just heard about the match, so we're really excited about that. So we know who our 3 physician fellows are, and now we're looking forward to starting the interview process for our 2 APP fellows. We have a robust team at Dartmouth on the palliative care team. We have been around since maybe around 2000, so maybe 24 years. And our team is well resourced. We have nurse practitioners, physicians, social workers, research coordinators, administrative assistants, pharmacists. It's a whole slew of us. And we also offer a very innovative curriculum. Every Wednesday afternoon, our fellows are in didactics. They learn communication skills. They learn complex symptom management. And our communication training is really powered by Vital Talk methodology. Our fellows learn early stage goals of care and late stage goals of care. And the other cool thing about our fellowship is that we have a wonderful collaborative between Dartmouth Hitchcock, UVM Medical Center, as well as Maine Med and Yale, and we do and Leahy. This is we call it a Northern New England Fellowship Collaborative. And all of our fellows come together and we learn, they learn complex symptoms, they learn communication training as a regional fellowship team. And they do this about 3 times a year at three different retreats. Our faculty are dedicated to teaching, and our learning blocks include the ICU, doing inpatient consultations in the ICU and on the inpatient consult team. We also have home hospice rotations, and then an inpatient hospice unit, which is called our Jack Burns Center for Palliative and Hospice Care. And I urge you to go to our website and also look at the video for the Jack Burns Center so you get a sense of what that looks like. We have long-term care, spirituality, pain medicine, advanced heart failure team, as well as a social work and spirituality rotations. I talked about the core didactics that happen on Wednesday afternoons. We also do some narrative medicine during that time. That's also a time for, we call it mutual aid. So there's a lot of peer support within our program, a lot of perspective taking, and a lot of shared wisdom gaining through Wisdom Wednesdays, which is a forum where fellows and faculty are able to bring up complex communication cases and really talk a little bit about the differential diagnosis going on there and techniques for managing the conversations going forward. We also have a specialist in substance use disorder who's nationally known, and that's Dr. Kathleen Brolio, who's a nurse practitioner and an addiction specialist who teaches our fellows about buprenorphine management. So all of this together is a really exciting time. Our fellows are also encouraged to do scholarly work, and we mentor them through doing palliative care grand round talks. We teach them how to teach, and we also teach our fellows, through the QI process. And so by the end of fellowship, all of our fellows have been involved in some type of deliverable QI project. We are accredited through APPFA. We are one of the first, the third in New England and the first in New England to get this accreditation with distinction. And very excited to be here. And thank you so much for your interest in our program.
Excellent. Thank you so much, Lisa. The Hospice and Palliative Medicine Fellowship is currently accepting, actually all of them are currently accepting applications. Our first deadline for our 2025 programs is Hospice and Palliative Medicine, which the deadline is at the end of the month. You'll see that on the last slide as well. So thank you very much, Lisa, for sharing, and we will move to our next one.
Oh, and before we go, Jess, if there's any, I'm going to step off for a little bit, but if there's any questions that come up, please send them my way. I'm happy to talk to anybody, and through the website, I'm sure you can get our contact information, but don't hesitate to reach out. And I'm also happy to have conversations by phone about our program.
Perfect. Thanks so much, Lisa. All right, next is our otolaryngology surgical residency. And we are going to be having Alex Higgins, who is going to speak about the experience there. And also, fun fact, Alex herself was one of the residents who went through the program, and now she's a program director as of this year.
Hi, everyone. I'm Alex. Thank you so much for coming tonight. I'm one of the 6 APPs. I work at Ear, Nose, and Throat here in Dartmouth-Hitchcock Medical Center. I completed that residency in 2022. Been here for a couple of years now. I specifically subspecialize in pediatric otolaryngology at this point, so pretty particular. But the APP otolaryngology residency is a 1-year-long program with surgical, outpatient, and inpatient components. We work with people across all ages, from birth to as old as you can get. It initially started in 2016 and has now graduated a whole 10 individuals, 6 of which continue here or at one of the Dartmouth-Hitchcock groups among the state. We have subspecialties such as head and neck cancer with resection and reconstruction components, otology, rhinology, skull-based surgery, oral maxillofacial surgery, and pediatric otolaryngology. This is a very procedure-heavy program. We do a lot of endoscopic and microscopic procedures, both inpatient and outpatient. On the slide here, you can see one of the lucky volunteers having a laryngoscope performed on the upper side of the slide. You can see it's done awake. We go through the nose, avoid that gag reflex. You get a nice view of the vocal cords back there. So it's pretty exciting. We also have plenty of time to first assist in the OR, including with our robotic surgeries. That's the picture at the bottom of the slide here. And the APP is the one that sits right bedside with the patient. The surgeon has to sit across from the booth. So we get a lot of hands-on practice. That specific robot's the Da Vinci. We do have a sleeker model now, so you'll have to come and see that one. We work closely with the medical residents as well in really a team-based setting. We share their excellent didactic curriculum, which not only includes specific anatomy, subject educational sessions, but also head and neck tumor board, a multi-specialty clinic, grand rounds, morbidity and mortality, some of the classics, just ENT specific. We only have 5 medical residents, and we cap at 2 resident PAs or NPs. And compared to our 15 surgeons, there's plenty to be done. There's plenty of case options, opportunity to participate. Our surgeons and APPs are all happy to teach both MDs and PAs, APPs alike. And they really create a hospitable work environment, really feels safe to learn, and even in some high stress situations. This program is perfect for you if you want to sharpen your operating room skills, learn how to do more of those independent procedures that you've never done before, and really just feel more confident and comfortable managing patients in different settings. But it's especially great if you love satisfyingly gross things like nasal debridements or cerumen and foreign body removals. If that's your thing, give us a call. I personally found this program by far like the most valuable of my PA education. No offense to my PA education, but and suggest it to really everyone who wants to take that next step in their medical career. After all, there are not many options where you can get paid to continue your medical education. I know it's not the full level, but it's not bad. I hope to talk to you guys more about this option. I think it's an excellent one. Please reach out with any questions or further interest in our program. I'm happy to talk to you in more detail, but that cues up my 5 minutes. So let me know if you have any questions.
Perfect. Thanks so much, Alex. That's excellent. And Alex is a testament of the program where she continued to stay on. We actually have quite a few people who have like high retention rate who continue to stay on. So that's really awesome.
We really like each other here after we get to know each other.
Great.
Thank you.
Awesome. Thanks so much, Alex. Okay, next up is the Neurology Fellowship Program, and very excited to have our current fellow, Carrie Weisheit, who is going to be able to speak about her experience and the Neurology Fellowship.
Hi, I hope you all can hear me okay. Like Jessica said, I am not one of the program directors, but I am the current neurology nurse practitioner fellow. We allow up to 2, so like they said, applications are open. In this program, it's a 1-year program. It's sort of a transition to practice. So any sort of new grads like myself, this is great if you have a special interest in neurology. However, if you have been a provider for years and are looking to transition into neurology, this is also a great program. There's a lot of support, I will say. I didn't expect to feel as supported as I am with not only the APPs that are in neurology, but also the physicians and the residents and the medical fellows as well. This program is sort of set up so there's a 6-month core rotation. So you're going to go through epilepsy, inpatient stroke, neurohospitalist, you'll go through the general neurology clinic, cognitive behavioral, and headache. And then the last 6 months of the program is more focused on your specialty. So you can do movement disorders, you can do the MS clinic, you can also do some sort of more different specialty rotations such as palliative care and psychiatry, neuroradiology. It's really kind of the last half of the program is focused around your interests. So for example, I'm really interested in epilepsy and memory, and I'm also interested in psych. So next year I'll be doing a neuropsych rotation, which is really awesome. You don't get that with many places, especially when you're not a psych mental health nurse practitioner. Something else with this program is there is a quality improvement or research project. You get a full month dedicated to working on this project. It is something that will be presented at Grand Rounds. You'll also do a poster and a potential journal publication with this project. I just started working on mine, and there are a lot of great APPs and physicians that help to toss out ideas. So if that's something that seems a little bit scary, I also felt a little bit scared as well, even though I have my DNP. There's a lot of great people who you can bounce ideas off of. In terms of didactics, every Friday we have a half-day academic day. This is also it's conjoined with the residents, so you work a lot with the residents in this program, and they're all completely lovely. There's also a grand rounds and a mega rounds where they present kind of interesting cases that have happened over the past few weeks or months. Along with didactics, you do get financial support for CME. There are specialized conferences that you can attend. I attended the Northern New England Neurology Society meeting this past year, and that was so interesting. They go over a bunch of different topics. They had discussions on neuro-oncology, MS, headache, the list goes on. It's great. There's also some sort of financial support if you wanted to go to the American Academy of Neurology meeting, which I'm planning on doing. And if you're interested in some, specialized conference, you can also take, your CME funds and use it towards that. For example, I'm using my funds for the American Epilepsy Society conference that is this week. So you really can do what you want with the money. And in terms of schedules, it kind of depends. It really depends on your rotation, who you're with, and I haven't had a problem. There's no weekends, no holidays, no nights. It's great. I think if anyone here is really interested in neurology, I would definitely encourage you to consider this fellowship. And of course, if you guys have any questions, you can ask me anything, or if I can't answer it, then I can, direct you to someone who can.
Wonderful. Thanks so much, Carrie, for sharing your experience. And it's really great to have that fresh on the ground right from one of our fellows. So one of the things that I want to also highlight that Carrie brought up is that Dartmouth Hitchcock Medical Center is an academic medical center, and we really embody the theories and thoughts that we are a teaching hospital. We want people to continuously be learners, but also to be teachers as well. And we, like Lisa had mentioned, we teach our fellows and residents how to also teach, and that's part of what we do in our organization. So education is part of our blood, and it is woven through the fabric. So next up, we have our Critical Care Fellowship, and I will have Amelia talk to you about that, who's our program director there.
Hi, everybody. Thanks so much for joining us tonight. It's awesome to hear from all the other programs, and big kudos to Carrie for taking advantage of all of those educational opportunities. It's so cool to hear about those. And so I'm excited to be here tonight and to talk to you about our Critical Care APP Fellowship. And I think I'm assuming here that a lot of the people on the call interested in these programs are either about to graduate from your APP program or recently graduated. And so just a little window into critical care. So critical care is fast-paced at times, it's slow-paced at times. It's really a team-based care model that, in your practice of critical care, you're going to really embrace and learn a ton about physiology. So if you love the physiology piece, if you weren't afraid of ABGs, if you really are invigorated by like the complexity of like hospital care, team-based care, these are signs that critical care is the right place for you. And within our program, our goal is to really prepare clinically outstanding APPs who are ready to practice critical care medicine, and as really effective members of like a multidisciplinary team. And we're really also looking to train, leaders, whether that be that you're a leader clinically or a leader more broadly when you graduate from our program. And we have some really specific competencies that we look for in our critical care providers and that you'll be introduced to right away in our program, and then that will guide you through your progression in your 12 months with us. We have a very, critical care or ICU focused clinical curriculum where you rotate through the critical care spaces here at DHMC. Your home base is really the medical ICU, where there's a very well-established group of APPs who've been practicing on a team together for 10 years. And we have 3 graduates of our program on that team currently. And we cover our service, which is half of the MICU patients 24/7. You'll also rotate through the SICU and the neurocritical care unit and do a brief rotation in the CVCC. And all of these spaces have APPs practicing and there to support you in your education. And then we have some critical skills rotations in airway management. So it's really time in the OR, getting comfort with the skill of intubation and managing difficult or just airways in patients who need them. We have time with interventional radiology, who are often helping us with the critical care of our patients. And then 2 weeks with Lisa Stevens' fantastic palliative care team, which is another skill set that we rely on. And we have, really essential relationships with Lisa and her colleagues and her fellows. And then you'll have the opportunity for elective rotations as well to really broaden the scope of your knowledge and understand the perspective of the consultants who we call on often in critical care. And we have a concurrent didactic curriculum that is tailored to you, the APP fellow, and really helps to guide you through some really basic and essential critical care knowledge from the literature and from a primary textbook that we use. And you also participate in our critical care physician fellowship lectures. There's a ton of teaching and learning opportunity. In the beginning, it feels like drinking from a fire hose, but gradually it gains more focus. And it's a challenging year, but it's high yield. And I'd be excited to talk to anybody more about details, and happy to answer questions specific to the program either during the Q&A period here or at any point that you wish to contact me or Jessica's team. Thanks, everybody.
Wonderful. Thank you so much, Amelia. All right. Last but not least is actually our very first postgraduate residency program, and that is cardiothoracic surgical residency. And we have Lisa, who is on the phone here today, and she is going to be talking about the program. She's one of our 2 program directors.
Hello, everyone. Thanks, Jess. As she said, I am Lisa Cotnor. I am the lead for the Thoracic Surgery Department APP team. I am also the co-director for the CTS surgical residency. So our institution is a little different in that the cardiac surgery and the thoracic surgery departments are entirely separate departments. So you will do a 12-month residency with us, but that will be broken down into 2 3-month rotations with thoracic and 2 3-month rotations with cardiac. Some of the highlights, as you see there, the cardiac team does a significant number of open heart surgery as well as minimally invasive procedures. They have 3 surgeons, a heavy APP team. They are, in fact, an entirely APP run team. So you don't have any residents on that service, which is a unique experience as well. On the thoracic team, you have 4 surgeons and 4 operative PAs and 1 non-operative NP. You are exposed to robotic cases, open cases like thoracotomies and VATS cases, which is a minimally invasive procedure, but without the use of the robot. We do a Monday through Friday type of work schedule in general. However, on the thoracic side, you also have a 1 weekend a month requirement where you get one-on-one time with the resident team as well as the attending that is on call. We also have a resident complement, and as you progress in your time with us, you will see that you become part of the teaching team, and you will help teach the new early stage or intern residents with us, which is a unique experience as well. I'm happy to take any questions, or they can be forwarded to me by Jess. Either way.
Perfect. Thank you so much, Lisa. All right, before we jump into the Q&A and also the timelines and the next steps, I'd like to invite back in Cheryl to talk a little bit about accreditation and what that means and the importance of it within Dartmouth Hitchcock Medical Center in APP programs.
Thank you, Jess. Maybe in your exploration of postgraduate programs, be they residencies or fellowships, you are seeing that some mention that they are accredited and some may not mention that they're accredited or leave it out. Dartmouth Hitchcock, well, let me just back up. APP postgraduate programs, whether it's a residency or fellowship, do not require accreditation. So unlike physician training, graduate or GME is the accrediting body for physician residencies and fellowships, and most are accredited. At Dartmouth, we believe strongly that our postgraduate programs, our APP postgraduate programs, should be accredited. So all 5 are accredited. It just so happens with the timing and who started and when and who, and the fact that accrediting bodies started out as separate entities, meaning the ARC-PA, which accredits all APP, LPA, undergraduate or entry-level PA programs. The ARC-PA also accredits some postgraduate residencies, and ARC-PA calls them residencies. Because CT surgery has been in existence for so long, that's the route CT surgery took. That is the route that critical care took. That is the route that ENT took. Then APPA, APP, Advanced Practice Provider Fellowship Accreditation came along saying we recognize both PAs and NPs. So this accrediting body will acknowledge PAs and NPs. Once they did that, our hospice and palliative medicine, as Lisa Stevens alluded to, and our neurology program sought accreditation from that governing body and received it with accreditation with distinction. It'll be 2 years ago in March. Most recently, Amelia Kerner's program, Critical Care, has sought accreditation through APFA. Our ENT program is seeking accreditation through APFA. Again, we just believe in the standardization, the formalization of accreditation, and that's why we will pursue that with all future fellowships and residencies. I also just wanted to add to what Jess said about the fact that we're an academic medical institution, and Dartmouth Hitchcock Medical Center is an academic medical center. And like Carrie, our current neurology fellow, mentioned, there is a generous CME budget, and that's in the setting of the fact that every department at Dartmouth has a grand rounds. So Department of Surgery, Department of Psychiatry, Department of Medicine will have a weekly grand rounds, and then also most have morbidity, mortality, and improvement weekly conference. So these are just some examples of what comes with an academic medical center. Definitely resource rich, definitely highly invested in teaching. Thank you, Jess, and I'll turn it back over to you and your team.
All right, wonderful. So hopefully we have piqued your interest. We have given you a high-level overview of each of the 5 accredited programs for postgraduates. And when we say postgraduates, that can mean students who are just finishing and completing their postgraduate education, so maybe brand new NPs or PAs. But also we've had a lot of our fellows and residents who have experience in the past and who are looking to really deepen their knowledge and solidify their skills in a particular specialty. So we absolutely are not just a new grad feeder into our programs, but also for those who are more experienced and have wanting to sharpen their skills and gain that really structured didactic experience. So I'm going to hand it over to my colleague and team member, Holly Yin, who is going to be able to talk to you a little bit about the dates that we have for the programs, when applications are, and then also afterwards we'll talk about next steps, how to reach out, and then Q&A.
Great, thanks so much, Jess. Hi, everyone. It's great to see you all tonight. Super excited that you're all here to learn more about these awesome programs. So some important dates coming up. The new year comes upon us quickly, and February is not that far away. As Jess mentioned earlier, the Hospice and Palliative Medicine program has our earliest application deadline, which is on December 23rd of this year. And that is for a July start date. Next comes our Neurology Fellowship program, which applications are due by February 9th. And those fellows will start in the fall. Cardiothoracic surgery applications are due on February 16th. And we also have an upcoming webinar specific to cardiothoracic surgery on January 22nd. So if you're interested in learning a little bit more about CT surgery in depth, we welcome you to join us at that webinar. Additionally, critical care is due on February 23rd, and we also have a critical care specific webinar on January 29th. So another opportunity for you to join us and learn a little bit more in depth about the critical care program. Both CT and critical care start in the fall as well. And then otolaryngology has a rolling application deadline. So we recruit for both a spring and a fall start in that program. And you are welcome to submit your applications now or in the future if you're still thinking about it. But we hope, as Jess said, that we have sparked your interest tonight and that we see your application soon. Next slide, Bailey. So you can head to our website. The QR code is here, or you can type it in. We can also put it into the chat. Oh, thank you. Thank you, Jess. To apply, learn more about the application requirements and what you need to have in order to apply to the different positions. You can also check out our provider recruitment page, dhproviders.org, where all of the opportunities are also listed. You can also see here the different email addresses for our programs. Those are all also on our website, if that's easier. But you can reach out to us. These emails are monitored daily by our wonderful coordinator, Bailey, and she will get it to either Jess or I, who manage the marketing and recruitment for the programs, or on to our wonderful program directors who can answer your questions. Next slide. Great. And with that said, we will open it up to questions. You are welcome to put your questions into the chat. You can come off mute. You can turn on your video if you're comfortable with that. We are all here, and many of the program directors and Carrie have been able to stay on to answer any questions that you might have for the next 15 or so minutes.
I'll just jump in, Holly Ann, and start because there was a question in the chat about interdisciplinary education that I saw. And I can absolutely give an example that involves both our program in critical care and the cardiothoracic program. We realized we had some overlap in our didactic needs. And so we've had some great joint sessions on both sides of our specialties. So we've had our cardiothoracic APP residents join us for a lecture on ABGs, a recent lecture on VV ECMO, which is a type of lung bypass support that we offer in the medical ICU. And then our critical care APP fellows have joined their cardiothoracic counterparts for lectures on chest tubes, and I think some other mediastinal topics as well. And so it's been fantastic to collaborate in that sense. I think overall the hospital, DHMC, is an incredibly collaborative environment, and there are a lot of opportunities to do that. And for our fellows who have really specific needs and desires in terms of learning from others in specific specialties, there's a lot of opportunity there.
Is it all right if I add something to that as well?
Yeah, please.
In our fellowship, we offer some elective time, as neurology has talked about as well, whatever your interest is. And so some of our fellows have done acute pain management. They've done 2 weeks with POCUS. They've done 2 weeks or more with hematology oncology in the outpatient clinic. They've done heart failure. They've done 2 weeks in critical care with the green team. And so we always try to, again, kind of see what your interests are and try to create opportunities for you to spend some specialty time in areas of focus that would overlap with your fellowship.
Thanks, Amelia and Lisa, for contributing that. I would also add that especially when you're thinking about how to make a decision about where your career is going to go, if there's a particular area of interest, even if it's not one of the existing fellowship programs, to let your program directors know that. And we have a really strong network of APP leaders across the system. And so these program directors and APP leads can reach out to each other and arrange opportunities for our postgrad fellows to get some exposure to other practice settings, to think about if that's a space that you might want to be interested in launching your career within our system.
Deb,
Thank you
Cheryl,
all
we
for
have-
answering my question.
Excellent.
Sorry.
Did you have follow-up, Aaron? Go ahead.
I had one follow-up for that. So, as you were saying, you can take some of your elective time to study some things that are your interests. So, I think, if I'm correct, Dartmouth does not do like cardiac transplant. But if that's something I was interested in learning a little bit about or reading about, is that something that I could maybe incorporate into the didactic curriculum?
I don't know if Lisa's still on.
I think Lisa is off. And so Aaron, I would follow up specifically. I mean, I think yeah, because I can't speak for her directly, but I think you're correct. We're not a transplant program. So we can't offer the direct like hands-on experience with heart transplant patients. But I'm sure we can offer, some learning opportunities, and I would reach out to Lisa Kottenauer, who can provide a little more context from her cardiac surgery colleagues.
And I would add that we do have a cardiologist. Her name is Dr. Ben-Simone, who works very closely with Tufts and who is a heart failure specialist and also a transplant cardiologist as well. I mean, we don't do the transplants here, but she has a direct relationship with Tufts where the transplants are. And so in our program, if you were, to be interested in palliative care, we could work something out with Dr. Ben-Simone, and possibly reaching out to, as Amelia has said, to Lisa Kottenauer or Chelsea, the program directors for CT surgery. They may be able to have a relationship with Dr. Ben-Simone as well.
Aaron, I just put the email address that goes directly to the CT mailbox, that we can make sure that you get that question answered if you'd like to further that.
Hello.
Yeah, I'll definitely reach out and I'll attend the webinar on it as well.
Excellent.
Hi, my name is Rachel. I'm interested in the Hospice and Palliative Care Fellowship. And my question, within the rotation blocks, is there a structure for increasing levels of responsibility to help, really promote independence while allowing the PA or NP to be comfortable with the increasing independence and complexity of these patients?
Rachel, thank you for that question. And yes, we do have a gradual progression toward independence. And I didn't speak to the details of that, but in the first third of the year, you're pretty much doing a lot of supervision or having direct supervision. And then midway through the year in the second third, you'll be doing a lot more sort of independent visits, symptom management checks, easy goals of care conversations. And then certainly by the third of the year, our fellows are fully independent, with sort of always having during the week a faculty at your elbow, someone to run your cases through and by and helping with medical decision making. And there's always a faculty at your elbow, but you'll be able to go off and do your own thing. And so I think that the program is really suited for progression toward independence and really getting you sort of on your own 2 feet. What we've found is when we've hired our fellows after fellowship, within a couple-week period of time, they are able to hit the ground running as full faculty members, and we give them even a little bit more time, but within a couple of months, they're also then becoming faculty and they're teaching medical students and residents. And so it's really shown to, in my experience, we've been able to really create independent practitioners who feel confident and specialized in palliative care. Also,
Awesome, thank you.
Yeah, our fellows also, we do a lot of board review. And so whether you're a PA and you're interested in the special certification for PAs in hospice and palliative care, or whether you're an APRN, we're hoping that our fellows will take the examinations at the end of fellowship and become certified. PA certification is called a CAQ PMHC, so it's certification or certificate of added qualifications in palliative medicine and hospice, and the nurse practitioner portion is the advanced practice hospice and palliative nursing certificate.
Thank you, Lisa, and thank you, Rachel. Rachel, do you have any other follow-up questions for Lisa Stevens?
I do not. Thank you very much.
You bet. And I'm happy to take Tule's question of, are we considering a residency or fellowship program for nurse practitioners in ophthalmology? At this time, we are not. The next in line, and how this takes place is the, NPs and PAs in certain specialties will reach out to us saying, we are interested in starting a fellowship program. So that is the case at this time with 3 different areas, which include orthopedics, primary care, and neurosurgery. Others have, expressed interest and are not as close. Emergency medicine is somewhat close. Neonatology, oncology has expressed interest. So we're expecting growth in these areas, not ophthalmology in the near future.
Said, we do have just one more comment on ophthalmology. We don't have a lot of APPs in ophthalmology right now, but we have an incredible orthoptist. So someone who is essentially an associate provider who specializes in adaptation and lens crafting, so to speak, and a really stellar rehab medicine group whose OTs really have developed an incredible expertise around visual rehab. So if that's where the interest lies, there's an opportunity to tap into some of those specialties and sort of the functional aspect of ophthalmology.
Go ahead, Charlie.
Hi, good evening. My name is Charlie Adler. I'm a family nurse practitioner student at UNH. My interest is in the hospice and palliative medicine fellowship. So I appreciate you, Lisa Stevens, for walking me through that. I did have some questions in regards to the QI projects and the scholarly work that is allowed to be done with your NP fellows. I'm curious, what are some examples of some QI projects or scholarly work that has come out of the APP fellowship through palliative medicine?
So one QI project, which is we reported on for our accreditation, was on, we called it the Goldilocks Project, and our fellows did a little research on morphine infusion orders at the end of life throughout the institution, and found that there was a lot of variation between orders, either too much or too little, and they created a project and tried to shore up some of those end of life and comfort measure orders throughout the institution. Another QI project that one of our fellows did 2 years ago was to look at orders for blood glucose monitoring at the end of life. We always are, tight control for our diabetic patients, but at the end of life, or when they're at the Jack Burns Center, which is our palliative and hospice center, we don't worry so much about tight control, but we still want to make sure that we manage them for comfort reasons. And so she created an order set and did a lot of research and worked with our pharmacists there. We have fellows who are working on a protocol for terminal vent withdrawal. So I'm sure that might be something that Amelia, we should see if one of your fellows might want to join in. And it's with Jeff Munson, who is our director of the MICU, and one of our wonderful physicians, Robin Larson, who's leading that effort. So many wonderful opportunities. Our fellows, 2 of our physician fellows are actually doing a project right now on looking at the learning experience in telehealth in the outpatient clinic. and we have surveyed all of our past fellows to just sort of get a sense of what it was like to be a learner on a telehealth visit with one of our providers. Scholarly work, we always teach our fellows to teach first, and then we do a mentored, they have a mentor who walks them through preparing a grand rounds, and so they do 1 hour CME talk, and sometimes they give that same talk for topics in medicine and surgery, so we, you know, double dip there. Our fellow Stephanie and I last year, we mentored, there's a number of us mentors, but we mentored Stephanie on a poster, and she presented a poster at our national conference on a case study that was an interesting case that we worked on together. So lots of cool stuff, and there's always mentors and plenty of people to tap into to help you along the way.
Wonderful. Thank you so much, Lisa.
Thank you.
One thing that I forgot to mention is that all of our fellows, which this is on the website, but all of our fellows and residents are hired into the 1-year program, and they earn a comprehensive benefits package, and the stipend for the year is $75,000, which, as you've heard a lot of people talk about, the immense learning and opportunity from a didactic perspective. So just one thing that I forgot to mention at the beginning. I see another hand. Oh, Chris, you have your hand raised.
I do. I did receive a message in the Office of APP mailbox that said, I have an MS in engineering and AS in nursing. I've been a nurse in the hospital setting for the last 5 years. My question is, will I be qualified for the HPM program at your institute? Could you hear me okay, Lisa?
Can you read that first part of that question again?
Sure. I have an MS in engineering and an ASN in nursing. I've been a nurse in the hospital setting for the last 5 years. Would I be qualified for the HPM program?
Unfortunately, you would need a advanced practice registered nurse licensed in the state of New Hampshire, which I believe would require a nurse practitioner master's degree. And so if you wanted to look at the New Hampshire board and look at the qualifications to obtain licensure as an APRN, I believe it would be, you would have to fit those areas of study. And Deb, I don't know if you had anything to add on licensure in the state.
Yeah, 100%. An MSN program to with a practice focus to be an advanced practice nurse practitioner is required. An accredited MSN program in order to apply for APRN licensure in both New Hampshire and Vermont, and also the same for any other entry point of these fellowships. You'd need to be licensed as an advanced practice provider, so PA or NP.
Thanks, Deb. So next we have Allison, and then after that is Ilanya.
Hi, I'm Allison. I'm also interested in the Hospice and Palliative Care Fellowship. Lisa, I had a question about something that I read on the website where the medicine fellows are allowed to do part of their fellowship at the VA in White River, but that the APPs are not. Is there any work towards getting that to happen? As a veteran, I'd be looking forward to eventually serving veterans in hospice.
Allison, are you a PA or an APRN?
I'm an APRN.
Okay. We have not had a lot of movement on doing it generally for APPs. The VA is a little bit more restrictive, and we were looking into at least doing it for our APRNs. And, you know, it's kind of like this, you know, we want to keep it as fair as possible, and our physicians go over there, but we haven't sent our APPs because we haven't been able to send both APPs. And so, because each year over the last couple of years, we had a PA and an APRN fellow. So I think if it's your interest, I think that, you know, my co-director is Dr. Jonathan Jolin, and he is the palliative care director at the VA in White River Junction. Very, very interested in having APRNs come over for a month. And so it is in the works, and a long-winded way to say that we're going to continue to see if there's an opportunity at the VA for our palliative care APPs.
Great, thank you.
Good evening. My name is Ileana Carpenter from Texas, and I'm also interested in the hospice and palliative fellowships. Sounds like we are. It's very, very popular. My question is, as a previous faculty, how do you evaluate each student? I also wrote it down because I'm having trouble with the connection. So if you can't hear me, I wrote down my question. I understand. I'm assuming that you will evaluate our interviews, of course, the paper that you're talking about, the presentation, but I was wondering about weekly or monthly tests, quizzes, other papers.
So I would say the evaluation process, during the interview process, we do use some behavioral interview questions. You're interviewed by a very nice group of interprofessional faculty members. So you may meet our social worker, you might meet our nurses during the interview process, and certainly our fellowship leadership team, which includes Dr. Max Virgo and Dr. Jonathan Jolin, as well as myself. And so then we do sort of a little evaluation, and everybody has a chance to sort of weigh in on the fellows. We look at your application process as well, and we have a certain way to look at that, and sort of, and then the team comes together and they rank all of the fellows that have interviewed, and so it's a similar process that we do for physician fellows as well. Along the year, there's a lot of and this is actually for everyone's program, and so Amelia, jump in if you have anything to add. But throughout the year, after each rotation, fellows are evaluated by the faculty that they've spent with. So for instance, if you spend 2 weeks with me, at the end of that 2-week program or that 2-week session, I would get an evaluation in our evaluation system that we use. It's called MedHub, where I'd fill that out and grade you on the competency gains that you've done over that the 2-week period. You also get a reciprocal evaluation of me as a faculty so that you can talk about the rotation yourself. We look at these evaluations cumulatively or aggregate evaluations every 3 months or so. And the faculty come together and review the aggregate data, look at your competency scores, because each evaluation question is kind of linked to a competency. And then we meet as a faculty, and then we meet with you to give some formative feedback. But you get, you get formative feedback along the way, and we teach our faculty to give feedback in time at the bedside. But then you also get this summative feedback on a quarterly basis. Hopefully that answers your questions. There are no tests, so you don't have to worry about that. But we do have pre-work for our didactics, because it is a flipped classroom, and we really want you to engage in discussion. And so having some pre-work ahead of time with some articles a week before helps you prepare for your didactic sessions.
Absolutely. Thank you.
Anything you would add, Amelia, about the evaluation process? Are there tests in MICU?
No, we don't have tests. We do have celebrations of learning where we go over test questions. And we may sometimes, I have certainly considered actually having like test questions to mark progress throughout the year, but it's really for our trainees to notice their own progress and for us to have a way to track that that's more objective. But yes, I think Lisa's like breakdown of sort of how we evaluate people and how we really provide you feedback, which like you as the trainee deserve that, need that, and that's an essential part of the program, is how and when you're evaluated and how you take that feedback to really form the basis of like where to focus your efforts so that you progress and grow as a clinician. That's essential to these programs.
And then there's regular meetings with your program director. So we set up monthly check-ins with our fellows so that they have a more formal opportunity to sort of sit down and check in on certain items. I have a check-off list that I go through. But there's also, you know, any open door policies to check in about progress.
Aware of the time, Jess, and I'm expecting that you're going to try to wrap us up. I'm hoping to squeeze in another comment, if that's okay. That in hearing the conversations about evaluations, it reminds me that it's also important to know that we are going to be working on how we do a better job of giving our faculty feedback. So it's an initiative across all of our education spheres right now to really pay closer attention to how we are helping our own faculty get stronger and do a better job in providing this education. So those evaluations continue to be super, super helpful as we move forward with that initiative.
Excellent. I want to make sure that we catch Allison has her hand up for one more question.
No, I just forgot to take it down. Sorry about that.
Okay, no worries. Does anybody else have any further questions that we can answer this evening? All right. Well, on that note, thank you so very much for joining us this evening, for asking such engaging, thoughtful questions, and we wish you luck on your journey. And if you have other questions that you think of after the fact, please don't hesitate to reach out. We also will be sending the slides within the next 2 days to get to you all as well. So you'll have that. And again, have a lovely evening, and thank you so much.
Oh, can I ask Aaron, where is KSU, Aaron?
Kansas State.
Oh,